We do expect that to be extended. Back here in the U.S., a clash erupts between two top White House officials over coronavirus treatment. White House trade advisor Peter Navarro reportedly lashed out at Dr. Anthony Fauci in the Situation Room while debating the effectiveness of hydroxychloroquine. Here's Navarro on CNN earlier today.
This is a situation where this drug could save lives, and I think there needs to be a debate, and you're right that I'm not the arbiter of this, but there's a lot of doctors out there who are on one side, and there's a lot of doctors on the other side. There's science going on. We are at war here, and what we're trying to do is make sure as few people die as possible.
Now, reports are Dr. Fauci is not backing off his belief that the drug is not a proven treatment for coronavirus. The FDA has not yet approved hydroxychloroquine for combating COVID-19. Let's bring in our panel of doctors to talk more about this. First up, Dr. Peter Hibbard. He's an emergency medicine specialist. He consults with hospitals all over the world, and he's been a regular guest here on the program. Also with us today, Dr. Jonathan Baugh. He's an emergency medicine physician and a telemedicine expert. He's also the co-founder of Remote Health Solutions. And finally, Dr. Richard McCormick is an emergency room physician. He also spent 20 years in the Marines and the Navy, serving in Afghanistan, Africa, and in the Persian Gulf. Thank you all for being with us today. It's great to have you. I want to kind of go around the group, starting with Dr. Hibbard. A lot of debate over the effectiveness of hydroxychloroquine. For a lot of us non-medical professionals, we're seeing this all kind of play out in real time, Dr. Hibbard. Why are doctors subscribing it if it does not work?
The point is the data initially looked out of Paris that it was positive when combined with other agents. However, the data previous to that didn't support its use by itself. The problem is in the combinations recommended, there's another drug called Zithromax and an antiviral. When all added together, they prolong our cardiac intervals, and they're concerned about a higher incidence of cardiac arrest or cardiac arrhythmias. That's irregular heart rates that involve collapse and possible deaths associated with that. That we're all concerned about just giving it to anybody outside. At the moment, some states have actually enacted a rule where you can't receive this unless you're hospitalized or in a state trial, and the prescriptions are being stopped at the pharmacy level.
Dr. Baugh, is there a concern from your standpoint seeing this debate play out in public?
You know, one of my concerns is the fact that we just don't have enough data yet, so people are forming opinions about something that we don't quite know yet. And one of the things that I've done is I've reached out to several of my intensivist friends who are treating the very sickest of these COVID-19 patients. And even within my friends, within this realm of intensivists and pulmonologists, there's still debate back and forth. A couple of my friends saying, definitively we think we see improvement in patients, and then others saying, listen, we just don't see any improvement in the patients that they're treating. So even the effectiveness of it still is to be determined, and we need more data. That's where it really comes down to. And you asked about, is it sort of harmful having it out in the public as we figure this out? I don't know that it's harmful. I think that more data is better. Public should be able to know this, and we're gonna figure this all out together.
I don't know if harmful would be the way I characterize it, but it is a little unique, I would say, just seeing this, debate about an efficacy of a drug playing out in such a vocal way for a lot of us. And, it affects the way we feel about these drugs and whether or not we want it to be available for our loved ones who might be suffering from this. Dr. McCormick, what's your take on all this?
Well, I agree. We don't have enough data. If you look at the different studies, they have over 80 studies on different medications, not just hydroxychloroquine, but also other medications. They're going to figure out in the long term. Unfortunately, this is a race against time. Right now, people are desperate. You can see people looking for solutions all over the place. There's a lot of conflicting data, not only in the medications we use, but also in the statistics of mortality rates. This disease is going to be studied for years to come. We're going to figure out a lot of things we didn't know right now, why certain people are much more susceptible to this than others, what the side effects of these medications are. This drug's been around for a long time, though. I've taken it when I was overseas in malaria areas, and other military people have taken it without any harm. But then there are other people that have had health conditions that they're going to be more susceptible to the side effects of this medication.
Certainly a lot of variables that have to be factored into what works and what doesn't work here. Let's also talk about the fight for supplies. Kentucky's Democratic Governor Andy Beshear has been vocal about his state's struggle to obtain crucial medical supplies. As of yesterday, Kentucky's confirmed cases just below 1,000. But Beshear said ventilators and personal protective equipment are hard to get because the state must bid against the federal government. We've heard about some of this competition. I don't know if that's necessarily the right word, Dr. Hibbert, for some of this PPE gear. Also, Illinois Governor J.B. Pritzker has been critical of the federal government response. Here he is talking about the lack of ventilators.
We're looking everywhere and anywhere across the world to get ventilators. Here's the problem. The president didn't enact or use the Defense Production Act until just recently.
Dr. Hibbert, I want to try to strip away some of the politics here. And you know, as somebody who consults with hospitals, you obviously talk to them about what type of supplies need to be on hand for regular use and in case of emergency. Whose responsibility is it to make sure that these pieces of equipment are where they need to be? Is it the hospital's responsibility? Is it the state, federal, local government? Who really bears the blame here?
I believe the blame belongs right at the home base of the hospitals. They could see what was coming on. They could see the rate of spread, and they understood what they needed to get in order to protect their staff and patients. And they did not actually have enough. I mean, this goes back many years. President Bush even discussed pandemics back in 2005, 2006, how important it was for us to have supplies. So these administrators are blaming the federal government for something that at the local level should have been actually there beforehand. And this includes the politicians of each individual state. They did not ensure the supplies were there.
Right. I mean, I think, Dr. Baugh, we have to remember that the governments don't run these hospitals, and that it has to be, you know, a chain of command, if you will, a flow of information from what the hospitals are seeing all the way up to the state and local officials and then up to the federal government. It has to work.
Yeah, you know, I agree with Dr. Hibbert with one caveat, and that's the fact that this pandemic really is, as far as the scope and the practice of it, is different than really anything we've seen before. You know, we kind of all went through the Ebola pandemic, and this is different in the fact that it really came here and it hit home to us. But did we have the opportunity to sort of see and plan before it came to our doorsteps? Yeah, I think so. And when we figured out national versus local versus statewide responsibility, I do think that at the hospital level, those that have been effective are the ones that have stepped out ahead and been prepared for sure.
Dr. McCormick, when I think about the warnings and you read about these warnings and all the Monday morning quarterbacking going on, you know, it reminds me of a tsunami warning. You hear about these, sometimes you get an alert on your phone about a tsunami warning. You know, there were a lot of warnings and nobody really thought this was going to be the reality that we're facing today.
Right, and this is something brand new. The interesting thing is when we're looking strategically to the future, what are we preparing for next? We don't know if it's going to be ventilators or medications. Every disease process has unique requirements, and we always like to point the blame at somebody. The fact is, we still don't know all the facts on this disease. We're right in the middle of it. The next one we're going to have to prepare for too, and it may be in a totally different requirement. So there's a lot of blaming going along. It's very unfortunate to see this happening instead of just working as a team. Yeah. If the governor wants ideas of how to get different supplies, there are multiple avenues he can take. Yeah,
the squeaky wheel gets the grease, they say, but sometimes that squeak can be a little hard to hear. Guys, stick around. We're going to have Dr. McCormick come back with us. Our thanks to Dr. Hibbert and Dr. Baugh for their insight. We've got more to talk about. We'll be right back with Dr. McCormick in a second. But first, let's talk about UK Prime Minister Boris Johnson. He is in good spirits.